Hello and welcome to Achievers Hive, dear learners. Let us take some MCQs today for your practice. If you're preparing for any kind of undergraduate program in which psychology is a subject, so the topics which are right in front of you on your screen, psychological disorder and therapeutic approach, these provide some questions which you can find it here. So let us start with the quiz. Question number 1, Nishu has some irrational thoughts in her mind, that is, I should be loved by everyone. This kind of problem should be treated by which method? So we have some methods given here: behavior therapy, logotherapy, no therapy required, or rational emotive therapy. So simply this is a cognitive problem, so this has to be treated with the help of the cognitive therapy, and rational emotive therapy is one of the cognitive therapy. So the answer for this question is option D. Coming to the next question, it is a very common question, that client centered therapy was proposed by whom? So you are given four options here: Freud, Frederick, Viktor Frankl and Carl Rogers. So the correct answer for this question is again option D. Coming to next question, Rahul always gets a coupon to buy something from the school canteen for his discipline in the classroom. It is a form of what? Inhibition, modeling, aversive conditioning, or token economy. You have studied this topic, token economy, in which a kind of token is given to a child or a person, and later on it is reverted in the form of some reward. So the answer for this question should also be option D, token economy. Now working through means what? The repeated process of using confrontation, clarification and interpretation, procedure wherein the client learns to behave in a certain way by observing the behavior of a role model or the therapist who initially acts as the role model. Gradual process wherein the unconscious memories are repeatedly integrated into conscious awareness. Simply you have to remember this point, that working through is a process in which these three terms, option A, confrontation, clarification and interpretation, are all together taken into consideration. So this option A has to be the correct answer for question number 4. Coming to the next question, Rahul is habitual of screaming, so his parents decided to take the food away. You can see the parents following a behavior which shows to be negative, but they want the result to be positive. They want Rahul not to scream, so that is a positive way. So it's a kind of reinforcement, but it is getting done in a negative way, so the answer has to be negative reinforcement. So the answer for this question is answer number B. What is treatment for the soul? You have heard this, learned this a lot of times, so you must know that it is logotherapy in which the treatment for the soul is done. So option D has to be the correct answer. Which one of these is not an approach to psychological intervention? Motivational interviewing, humanistic therapy, cognitive behavioral therapy and group therapy. See, A, B and C, these are the three options which can be done for an individual. Psychological intervention means an approach which is applied to a person or an individual to clarify his problem, to help him or her solve his problem. So this group therapy would be the answer, because it is not an approach to psychological intervention. So the answer has to be option D. According to Sigmund Freud's psychoanalytical theory, what is the role of the superego? Establishes the rule and prohibitions, telling us the right thing to do, using guilt to override our impulses, mediates between the unrealistic and external real world. It works out realistic way to satisfy its demand, or it demands immediate satisfaction. So the answer for this question number 8 has to be option A, because it talks about the rules and prohibitions, tells us what should be done. Superego is the next level of ego. So answer A, option A is the correct answer. Who is psychodynamic therapy most beneficial for? Look at the options. Client whose sense of self is stable. If the sense of self is stable, that means the person is very good at self. There is no therapy required for the person. That means the person is doing well. Clients whose interpersonal emotional issues are most prominent. This has to be the answer, but let's see to the other options as well. Clients whose sense of self is stable and clients whose interpersonal emotional issues are most prominent. See, the option A has already been taken in C. So if option A is not the answer, C can also not be the answer. Option D, clients who do not display intrapsychic conflict. If they do not display the intrapsychic conflict, then what is the need of the psychodynamic therapy? So option B has to be the correct answer for this question number 9. Which among these is not an aim of the cognitive behavioral therapy? Learning not to have intrusive thoughts, to develop rational thinking. Remember that it is asked which one is not an aim of the cognitive behavioral therapy. Okay, so option A, learning not to have intrusive thought, has to be the answer, because it is not an aim of the cognitive behavioral therapy. So option A has to be the correct answer. What is the study of mental distress is known as? Psychosomatics, psychoanalytics, psychopathology, psychodynamic. Psychopathology is the correct answer for this question. The term abnormal psychology refers to which of the following? Let us have a look on this question number 12. The psychological study of people who are fundamentally odd, psychological research carried out using unconventional methods, psychology relating to atypical patterns of thoughts, feelings and behaviors, the more obscure areas of psychology that relate to topics such as what sheep thinks about. The correct answer for this question is option C, psychology relating to atypical pattern of thoughts, feelings and behavior. Let us go back to the question. Abnormal psychology refers to relating to atypical patterns of thoughts, feelings and behavior. It works for it actually. So option C has to be the correct answer. Which is not form of clinical observation? Interviewing, self-monitoring, assessing clients in their home, assessing clients outside of their home. So the answer for this question number 13 is C, assessing clients in their home. It's not a clinical observation. Question number 14, the diagnosis of mental illness is generally carried out by which of the following? A clinical psychologist, a counselor, a psychiatric nurse or a physician. You already know about it, that what a clinical psychologist does, treats for the mental illness. Another answer for this question could be a psychiatrist. Okay, so if you are given a psychiatrist in place of this clinical psychologist, you can also go for that answer. That also will be correct. Which of the following is not a part of the mind according to Freud's psychoanalytical theory? You know, the superego, the subego, the id, the ego. There is no such term as subego, so this is not a part of the mind clearly. So the answer is option B. Question number 16. A new client comes into the office and tells you about experiencing excessive anxiety, restlessness, muscle tension and having headaches almost every day. She also tells you that she has trouble sleeping and can't concentrate at work. From the disorder which are given in the chapter, which one sounds the most logical? So there are 4 options given to you. The person is experiencing anxiety. So if person is suffering from the generalized anxiety disorder, after checking the symptoms of the person in the question, we can come to the conclusion that the person is suffering from the generalized anxiety disorder. So option D has to be the correct answer. Coming to the next question, which is not a positive symptom of schizophrenia: delusion, avolition, then disorganized thinking and speech, and hallucinations. So the answer for this question is option B, avolition, which is a negative symptoms, and A, B, A, C and D are the positive symptoms. So option B is the correct answer for this. CBT often focuses on which of the following? You are given 4 options for this: repressed memories, genetic predisposition, traumatic incidents, or problematic ways of thinking. CBT, it is about the cognitive behavioral therapy. So at the cognitive aspect, it talks about problematic ways of thinking. So option D has to be the correct answer. Question number 19. Hoarding disorder comes under which category? OCD, ODD, none, or ADHD? So hoarding disorder is a kind of problem which comes under obsessive compulsive disorder, which is OCD, in which a person is not able to throw the waste material from their home. They want to just collect all the garbage. So this is a kind of problem in which they are very much occupied with those things. So option A has to be the correct answer for this. Shweta always fears whenever she has to enter in some new or unfamiliar situation. Which category of phobic disorder it is? So it is known as, this specific situation is known as agoraphobia. So option C has to be the correct answer. Naman, a 12-year-old boy, has marked difficulties in social interaction, communication. He is suffering from which problem? So this is clearly the option, the answer that has to be autism, because in autism the person suffers from all these conditions, all these problems. So autism is the answer for this question number 21. Unexpected travel away from home, this is particularly known as dissociative fugue. This is the definition of fugue. You have to remember that in a fugue, person travel from their home and that is completely unexpected. So the correct answer for this question number 22 is option C. Which is the latest clarification of psychological disorder? DSM-5. You have studied in your syllabus that DSM-5 is the correct answer for this 23. Which of the following is a neurodevelopmental disorder? ODD, ADHD, conduct disorder, and separation anxiety disorder. So ADHD is a neurodevelopmental disorder. Rest are not the neurodevelopmental disorders. Schizophrenia is what? It is a psychotic disorder. You already know that. So option C has to be the answer. Bodily symptoms without any physical disease are known as somatoform disorders, because somatic symptom you have studied with the name somatic symptom and related disorder. Somatoform is another name for it. So option D has to be the correct answer. Khushpreet always believes himself to be specially empowered. He is suffering from what kind of delusion? It is clear that he's suffering from the delusion, and this particular problem is known as delusion of grandeur. Which of the following is not the characteristic of psychological disorder? Dangerous, dysfunctional, deviant, disturbing. Disturbing is not one of the 4 Ds. So option D has to be the correct answer. Rajat always overthinks that his feelings, thoughts and actions are controlled by others. This is known as delusion of control. When people feel that they are being controlled by other people or other activities, so we call it delusion of control. Question number 30, which does not come under the positive symptom of schizophrenia? Hallucination, FTD, delusion and flat affect. So flat affect is a negative symptom of schizophrenia, rest are the positive. Inattention and impulsivity are the main features of ADHD. These are the two features because of which the ADHD gets completed. The problem of ADHD includes all these two problems, inattention and impulsivity. That is why we call it attention deficit hyperactivity disorder. So option C is the correct answer. Ria always cries when her father drops her to school and becomes tense. Which disorder is this? This is a separation anxiety disorder which is being experienced by Ria. Extensive but selective memory loss is known as dissociative amnesia. Amnesia is a problem of forgetting in which people are unable to recall the past memories. People who are at risk fall under which category of abnormal behavior? That is stress model, cognitive model, behavioral model or psychodynamic model. You have 4 options for this question number 34. That is stress model is the correct answer. Coming to the next question, condition with no emotions at all, which this is known as flat affect. There are no emotions experienced by the person, neither their own or of other people. So this condition is known as flat affect. Kirti usually smells an unpleasant odor whenever she wakes up in the morning or sometimes in the middle of the night. This is a kind of hallucination. This particular hallucination is known as olfactory, in which people can smell something which is not existing at all. This is the case where the client reverses or experiences passionate feeling for the advisor and looks for the specialist endorsement. This is known as positive transference. So we discussed some questions. You would have understood these questions. If you want to receive this PDF, please join us on our Telegram channel. Also subscribe to the channel if you have not done it yet. Please share with your friends, those who are preparing for any kind of competitive exams. See you very soon in the next video. Till then, take care. Bye bye.